Hello, welcome to another short educational video from New Century Planning. My name is Bob Ryerson. I'm the founder of New Century Planning, and we are pleased to have today with us Peter Hegel. Peter is our resident expert in Medicare and is going to help us demystify what can be a confusing subject for people, an important one. Peter, welcome. Thanks for coming.
Thank you. Thanks for having me.
Great. So I guess let's start at the beginning. When did Medicare come about? I guess before Medicare came about, you were on your own in your 60s or 70s, right?
That's right. Yeah, it's a federal program that started in 1965.
Wow, it goes back a while.
Yeah.
65, and it was just, I guess we should look at the component parts. There's Medicare A, which is what? The hospitals, right?
Right. So you have, the government brings you two parts. So Part A is your hospital insurance. So that covers, your inpatient hospital care for your doctors and nurses to come check on you. Mm-hmm. So you got to think of it as
surgeries or things like that, right?
Some surgeries, but the surgeries usually fall under Part B. But your A, you want to think of as your facilities coverage. Okay. And then Part B, the government also brings you, is your medical. That's the bulk of your coverage.
Doctors and labs and outpatient stuff.
That's right.
Okay. And then they realized at some point, hey, what about prescriptions as everybody's getting older? In fact, one of the things I guess we should mention is that the aging population, the baby boomers in particular, just the tidal wave, Medicare and Medicaid, which we'll talk about later, is I guess one of the biggest expenses, the national debt, the defense, and Social Security and Medicare, right? I guess we don't have time today to go into it, but there's something that everybody should be aware of is that Medicare is expensive, and the government can't figure out what people's health is going to be when they're in their 70s, 80s, and 90s. So it's an open.
Correct.
This is the problem that the states are choking on, and the government is the medical, not the Social Security, right? I mean, Social Security they can figure, okay, she'll live to 89, we'll pay her so much. You can't quantify somebody's health situation. So Medicare. So A and B we talked about. Then they came up with D, which is prescriptions, which was when?
Well, Part D was a standalone prescription drug program. So that came about in 2006. 2006,
okay.
Right, to fill in the gaps. So the way that works is it's administered, the government sets the rules, but it's administered by private companies.
Okay.
Right, so you can enroll into a Part D plan, and then there's more details in how that's administered and how you pay your responsibilities.
And this would be part of traditional. This is A, B, and D.
D is actually standalone, right?
Okay.
All your taxes and all of your that they take out during your working career, that goes into funding A and B.
But not D.
No, but D is the standalone that you have to pay.
Okay, and then we've skipped C for some reason, right? So what is Medicare C? What's another name for Medicare C?
Right, so Medicare Part C came about in 1997, and that's called the Medicare Advantage Plan. Right, so those are the plans where it's administered by a private company, so everyone's getting Part A and B, but it's the government telling a company like, let's say, Aetna, okay, here's all that money that we receive in taxes, you guys administer it.
And
so
decide what you can cover for that?
Correct, and they bundle it together. It works much like a traditional group plan that you're probably familiar with your employer.
Okay, and now I see a lot of commercials on TV pushing with some retired actors pushing Medicare Advantage C, and I think the reason is because typically there's no premium. We haven't talked about costs yet, but let's talk about costs. So
sure.
Medicare A is your facilities, your hospitals. There's no monthly cost for A.
Right, A is generally premium free, as long as you paid into it for 10 or more years during your working career. And that's for you and your spouse. So even if your spouse wasn't working, it counts toward her.
That's good. And B is a monthly premium, but it's not a big deal. How much is that?
Right. The standard premium for this year, 2023, is $164.90.
Okay. If you're over 65 and you have significant income, then that can be 2 or 3 times that, right?
Right. So then it goes on almost a tiered system. So depending on what range of income your income falls into, that premium will go up, right? So if you make a certain range, then it's just going to go up. So really, the more you make, the more they take.
And that drives people crazy. I can tell you at this conference table, I don't know why, it's only a few $100 in the scheme of things, but that surcharge annoys a lot of people.
Yeah, and the good news is, though, they do look back 2 years, but there is a way to appeal that. So I always help folks with that process if they need to appeal it, and sometimes they do approve it.
Okay, so we skipped this, but age 65 is Medicare eligibility. So right. You may not be, courtesy of your date of birth, you may not be eligible for full Social Security benefits till 67 or 66 and a half, but at 65 you can enroll in.
That's correct. Yeah, they're
It's-
two separate programs.
Right.
You can get Medicare without Social Security, and you can get Social Security without Medicare. And there's different scenarios that, would fall into that. But also, besides being 65 or older, if you are have a disability with 24 consecutive months where you're collecting Social Security, and
Social Security disability.
Social Security disability,
And you're also
right,
eligible for Medicare.
right, any age, 18 and over, but
So it's not just 65.
yeah,
Okay. Well,
or if you
that's
have
important.
right, and I'm sorry, if you have Lou Gehrig's disease, end-stage renal disease, which is kidney failure, those
Okay.
two will get you eligible.
Okay. So let's go back to 65. We talked about A and B, and D is the prescription. C is this no premium per month, and that's very appealing to people
Right.
who want to save the $165 or whatever the case is. But I come from a school that says there's no free lunch. So can you tell me if there's a downside to Medicare Advantage? Because it sounds great. We got hearing and vision, and I'll give you a free toothbrush. They throw
Right.
everything into these advertisements, but what are they forgetting to tell us? Or what is the downside of a Medicare
Right.
Advantage?
What are
I'm
the-
not saying
what are
it's
the
not
cons?
good for some people, but
Right. What are the cons? Right.
What are the cons?
Yeah. So generally, there's plans that are zero premium. You do still have to pay your Part B,
okay.
so that is not free, right?
Right.
And then as you use the services, now you're paying as you go. So every time you see a doctor, you're paying a copay. Every time you get an MRI, you have to pay. Also, there's a network, so you're limited to whatever the network that the private insurance company sets. You can't just go to any doctor or any hospital like you can with original Medicare.
It's a network issue. Okay, so you have limitations. And my understanding is that year to year, the companies can change. We're no longer in this area. We're no longer covering that hospital. So
Correct.
the Medicare C has some, you got to be a little careful if you're going to do that.
Right.
It's
important.
appealing mathematically, but you got to be a little careful.
You do, and you have to have a review every year. It's really important because, again, your doctors could get pulled out of the network
Or the hospital.
or the hospital. Right.
Okay. And then what I was referring to, I thought you were going to go down, is that if you have a bad year with Medicare C, is you're out of pocket. Instead of saving money, you're spending, what, $75, $50? Worst
Right,
case
that's
scenario?
the maximum out of pocket. So $7,550 is pretty steep. I mean, you can look at it as a protection, all right, so after you pay that amount, then the plan does pick up, but it's annual. If you had a bad time up till November 30th or December 31st, and it continues into the next calendar year, that $7,550 resets that maximum out of pocket. So it's calendar year based.
Whereas, and we didn't get to this yet, if we're doing traditional, instead of C, we're doing traditional A, B, D, and a supplement.
Correct.
They call it Medigap, right? There's gaps in A and B, and the supplement or the Medigap policy fills that in.
Right.
One of your specialties. They're not terribly expensive either. I guess it depends on your health in certain circumstances, your zip code. But if somebody is 65 and relatively healthy and enrolls in a timely fashion, $120, $150 a month for the supplements, right?
Yeah, I mean, that could be the range when you first enroll. There's options around that cost.
It gets more expensive when you get older.
When you get older, the premiums do go up, but you can shop around. But then again, now you're deciding, okay, well, I'm going to pay a premium, but I'm paying that premium so that I have less out-of-pocket costs when I use the service. Whereas the Medicare Advantage, it might be zero premium, but you have to go in knowing I'm going to pay more out-of-pocket costs
Right.
as I use the service. So that's kind
So,
of the
so I
difference.
guess getting back to that, if you're 65 and you're pretty healthy, you got no concerns at all, you say, what, I'll take my chances. I'll do the zero. I'll do, I'll try to save some money. I think that's dangerous.
The advantage.
Things, yeah.
Right.
But I know, we've had this discussion before.
Yeah.
I mean, my partner and I lean towards, traditional, do A, B, D and a supplement. It's not that expensive, and it takes everything off the table. God forbid you could have a heart surgery, and there's nothing out of pocket, basically, right?
Right, just your annual deductible.
Which is 200 and something.
$226.
To me, that makes sense.
for-
Now, of course, we try to build it in the budget, and if there's surcharges, people get annoyed. But okay, let's go back to the supplements. So the supplement is designed to fill in. They're not that expensive. There's different, what do they call it? They're letters. They're different
Right,
plans.
so there's 10 letters, A through N. The ones that drive the conversation are F, G, and N. So the letter is what determines your benefit,
Okay.
right? So that it's the same whether if you get a Plan G, let's say in New Jersey, the Plan G is the same exact benefits as they are in Arizona. Whether you have Humana, Aetna, or United,
Whoever, right.
it's the same
Visual
benefit.
of Omaha. They're all the same. So those are federally mandated. The coverage is the
Standardized,
same across the country. So then it becomes price and customer service. That's the important factors.
Right, the difference in premium, the financial strength of the company. Sometimes you have these new companies that come on the market. It might be what do they call it, P&C company,
Right.
property and casualty.
Yeah,
They might come
dip
on the
their toe
market and
into-
offer it. We're going to offer a supplement plan and have a really low premium, but there's no history in the market. They're not established. So, you got to watch. You don't always just want to go on price. Is what I'm
Well,
trying
that's
to
what I
say.
was referring to. So
Right.
the price is important, but Mutual of Omaha was one of the first ones in 1966. We know their service is real good. So, you got to be the customer service and the time, the experience, and then the price.
Right.
So you mentioned these letters. Now, I know that over time the government has chopped a bunch of these things away, and we kind of laugh at this, but they took away F. Tell me, what was the difference between F and G now in these plans?
Right. So F basically got you full coverage. So it's of course going to be the highest premium, but you went in basically you're paying
Nothing
to not have any bills. You're never going to get a medical bill with F.
And the only thing difference with G is it's the same thing, but you're paying the 226.
The 226 annual deductible. So that's
So
the
Peter,
only difference.
are you telling me that the government needs the money so badly they want that too? They took away F because they want that $226 a month for millions of people. That's what you're
kept the
telling me.
226. That's right.
That's what you're telling me.
They wanted you to have some skin in the game, Bob.
Well, why not? We'll change these plans. Okay, so whether somebody really is an individual choice, you are a consultant. I should mention that people would be wise to use your services in Medicare if they're confused and they don't know which way to go, because you don't charge anything. You're paid internally by the carriers.
Right.
So you can guide somebody why they should use N over G or whatever the plan is. For somebody who likes to travel, is there coverage overseas with a Medicare and a supplement plan if they're in Spain and something happens?
Right. It's only for emergencies. So you can't just, go get a regular treatment or whatnot. It has to be an emergency. So let's say you broke your leg in Ireland, right? And it's $20,000. So, you're going to have to foot the bill and then come back and bring your paperwork.
And get
And
reimbursed.
Medicare pays 80% of that, right? And then you're responsible for the other 20% up to $50,000 lifetime.
50,000. Okay.
But otherwise, I'd recommend getting travel insurance.
Right.
If you're going to be, especially if it's an extended period, or if you're hiking some dangerous cliffs, or
Or drinking certain things in Ireland, perhaps.
right.
Last question, or we can finish up with this. There's confusion a lot of the times between Medicare and Medicaid.
Right.
And Medicare, we just went through and explained to people the federal government program for people over 65. What is the difference between Medicare and Medicaid?
So Medicare is the federally mandated health insurance program that everyone pays taxes into. Medicaid is based on your income, your need. If you meet a certain threshold, if you're below a certain threshold, you can apply to qualify for that. It is subsidized by the federal government and the states, but the states administer it. So that's the difference. But you can have Medicaid and Medicare, and they do work in concert with each other. And Medicaid will fill in the gaps that
Medicaid
Medicare
becomes
doesn't.
the supplement, so to
Becomes the
speak.
secondary payer, yeah.
Okay. And Medicaid is for people who don't have enough assets or income.
Correct.
So, okay. One thing I guess we should mention is that Medicare and Medicare supplements do not cover custodial care, do not cover long-term care.
Right. Long-term care is completely separate insurance.
What is it, 90 or 100 days?
100, after 100 days, yeah.
You're on your own, right? So if it's
You're on your own.
intermediate or custodial care, that is not covered. It's only acute care. It's only for 100 days. So a lot of the planning that we do is trying to address that long-term care need. The stats are terrible, 69, 70% chance that we're all going to need it before we pass on.
Right.
So I just want to be clear that Medicare, ABD, Advantage, and a supplement, none of them cover.
Not long-term care.
Not long-term care.
Maybe some like intermittent home health care, like sporadically if it's medically necessary to
Medically
get you back
necessary.
on your feet.
But that's it, right?
Not 24/7 nursing care or anything
great.
like that. Yeah.
All right, I think you helped us demystify. I hope we demystified.
I hope so.
Anyway, thank you for helping us
Yeah.
out today.
My pleasure.
Great, thank you.